Hello everyone and welcome to this video about the training workshop on equality, diversity and inclusion in research that has been developed as part of the Horizon 2020 funded project All Interact, widening and diversifying citizen engagement in science in collaboration with the NIHR Oxford Biomedical Research Centre, NIHR Oxford Health Biomedical Research Centre, the University of Oxford, and Oxford Brookes University. The workshop was designed for public contributors to biomedical research and was held in person in July 2022 in Oxford. Altogether, 25 public contributors from diverse backgrounds participated in the workshop. The purpose of the workshop was to support public contributors' learning and understanding of equality, diversity, and inclusion issues in research. The learning outcomes of the workshop were to help public contributors to become citizen experts on equality, diversity, and inclusion in research, and to help public contributors to provide researchers with more informed input on equality, diversity, and inclusion in research. As for the impact of the workshop, we believe that by taking into consideration equality, diversity, and inclusion issues in research, together researchers and public contributors can improve the quality and relevance of research to society as a whole. The workshop consisted of an introduction, active learning in small groups, and sharing of knowledge with all participants. The workshop started with an introduction on the benefits of equality, diversity, and inclusion in research, needs of underrepresented and underserved communities in research, and also ways of working during the workshop. Active learning in small groups was organized around 5 different topics. Each topic had a table with a dedicated facilitator. Participants first read and established, with the help of the facilitator, a common understanding of the scientific evidence on their topic that was provided on their table. Participants then discussed the evidence as well as their relevant lived experiences. Then participants agreed on the key learnings and discussion points that they would like to share with the participants from other groups, and they also nominated a rapporteur. Sharing of knowledge with all participants took place at a plenary session. Each group took turns to present their key learnings and discussion points to participants from other groups, and participants from other groups also had opportunities to ask clarification questions, as well as make comments and share their relevant lived experiences. The workshop covered 5 topics, including gender diversity in teams, gender diversity in clinical trials, neurodiversity in teams, racial and ethnic diversity in teams, and racial and ethnic diversity in clinical trials. Importantly, the scientific evidence for learning and discussion was summarized in plain English, like in the example of evidence on gender equity and clinical trials here. The original research articles were also provided on the table. Upon completion of the workshop, participants received a certificate of training, which detailed the 5 topics that were covered during the workshop. To evaluate the utility and impact of the workshop, we conducted a survey among all participants, and 6 participants were invited to take part in a focus group. Results show that 83% of participants rated the workshop as very helpful or extremely helpful. Participants reported gaining new knowledge and confidence related to equality, diversity, and inclusion in research. Participants agreed that the workshop would help them to be better involved in research. Remarkably, just 3 months after the workshop, participants gave examples of how they apply learnings from the workshop in practice, indicating credible pathways to impact. Overall, the workshop was very well received, generated some news coverage, and we also shared information about the workshop via institutional websites and social media. We welcome opportunities to share our workshop materials and expertise with all interested groups and invite collaboration. Thank you all for watching, and a special thank you to Horizon 2020 Project All Interact for support.